Welcome to today's webinar. Thank you for joining us for our second presentation in this four-part series in honor of Maternal Mental Health Month. We are excited to be featuring speakers in the field of perinatal mental health, presenting on topics focusing on parents' emotional well-being from a cultural lens. I am Irina Polanco Ventura, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. We are proud to be providing this program via our Perinatal Mood Disorders Initiative. And for those who may be unfamiliar with the Partnership, we are a nonprofit agency licensed by the New Jersey Department of Health. Our mission is to meet the healthcare needs of women, infants, and children in Northern New Jersey while coordinating education, outreach, and advocacy through regional planning and collaboration. We are very grateful to be hosting this webinar entitled Addressing and Improving Asian American Women's Mental Health. It is very fitting as we also honor Asian American and Pacific Islander heritage during the month of May. Before we continue, I'd like to thank the New Jersey Department of Health for funding important programs such as this one and allowing us to provide essential services to families. If you'd like to learn more about our Perinatal Mood Disorders Initiative, which provides support to expectant and new mothers, please visit the Partnership's website at pmch.org and click on the Programs tab. Before we get started, I'd like to review some important information. So after 1 hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us with feedback on the program. In order to receive your certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the Partnership's YouTube channel. Also, we will be muting all attendees' microphones during the presentation, but we still want to hear from you. So you can write your questions during the talk in the question box, and the speaker will respond to as many as possible at the conclusion of the presentation. Now, I would like to introduce today's speaker, Dr. Chris Hamm. Dr. Hamm is the first Asian American who was promoted to full professor at Boston University School of Social Work. She is dedicated to reducing health disparities among the Asian American population, with a particular emphasis on building empirical evidence in health risk behaviors. Via funding from National Institute for Mental Health grants, she has developed and tested theoretical frameworks which explain suicide behaviors among Asian American women. The culturally grounded interventions she has developed, including AWARE and Youth Aware, which stands for Asian American Women's Action in Resilience and Empowerment, have been implemented in colleges and high schools. She has also received the Research Mentor Award at Boston University and the Innovators Award from Asian Women for Health. Many of her accomplishments are reflected through her authorship of more than 60 peer-reviewed journal publications and 200 professional talks locally, nationally, and internationally. Welcome and thank you for being with us here today, Dr. Hamm. Take it away.
Thank you so much, Irina, for your kind introduction. And thank you so much for the Partnership for the Maternal and Child Health of Northern New Jersey. Okay. I would like to say that I have no financial disclosure to make. And my study, which I'm going to talk about for an hour, has been funded by National Institute of Mental Health and National Science Foundation. So today's webinar, when I'm talking about Asian American women's mental health, I would like to start off with COVID-19 related Asian American discrimination, because I think it's important for us to talk about here and now issue. And I'm going to move on to talk about impact and legacy of COVID-19 discrimination and how that discrimination started and when they started against Asian Americans. And I'm going to talk about the impact on those discrimination on Asian American adolescents and particularly young women. And I'm going to move on to talk about the structural inequality as well as action plans and how we can successfully address Asian American women's health. So America in Korean is written as 미국. You can see this word, 미국. Mi is beauty and 국 means country. And these are coming from the Chinese characters. And when we put these things together, America literally becomes a beautiful country. Growing up in South Korea, I had a fantasy about America. I imagined a beautiful country with a charming people and the land of democracy, justice, and equity. In this beautiful country, we've been dealing with crisis, health crisis, racism, xenophobia, and crisis with gun violence. According to Center for Study of the Hate and Extremism, the overall hate crime in the US dropped about 7% in 2020. However, the hate crime targeted Asians increased by 150%. And you can see the big cities such as New York City, LA, Boston, substantially grew the hate crime rates against Asian Americans. And vandalism is a part of the hate crime. And vandalism is a very important hate crime because it instills fear to every single member of the communities or the targeted groups. Now, according to the study that we were funded by NSF, Asian American young people, so 68% of the Asian American young adults who participate in our survey, about 212 members, they reported that they have been subject to COVID-19 specific anti-race Asian American discrimination. And then you can see from this graph that about 15% of Asian American young adults reported that they've been victimized in relate to verbal assaults or the physical assaults. So we wanted to see if there's an association between COVID-19 anti-Asian discrimination and PTSD symptoms. PTSD is a post-traumatic stress disorder symptoms. And we have found that those people who have experienced COVID-19 anti-Asian discrimination particularly showed higher symptoms of PTSD. And every number, behind every number, there are stories. So these stories are reported by those people who participate in our survey. And they talked about these fearful and traumatic events related to COVID-19 discrimination. So for instance, one particular woman said, my dad sent me a text about an Asian American woman who got acid thrown at her and tells me to be careful. I tell him I live in a predominantly Asian neighborhood, so it's okay, but in reality, I am scared. Another person said, my dad also tells me that he gets stares at the grocery store. While nothing direct has happened to either one of us, we live in fear. My youngest cousins are 2 and 5 years old and have been kicked out of their preschools because of their race. And when you look at these stories, there are some common themes. And these are the racialized trauma. What that means is that they feel the loss of safety. They also are grieving collectively. They also experience a sense of shame. That is a common theme of racialized trauma. And now, more than 1 year after COVID-19, we can begin to see this long-term unemployment rates. And you can see this, that Asian Americans actually have a higher rate of long-term unemployment rates compared to white, Black, and Hispanics. And Asian American adolescents and children are most likely to say that they are reluctant to go back to school when the school has opened. So this is from Boston Globe, and Boston Public School students reported that 35% of Asian American students reported that they do not want to go back. Oh, sorry. Actually, they're the only one who want to go back and want to be in person. The only 35% compared to other racial groups who are more than 50% of the people who wanted to go back to school. So the reason why only 35% of the students want to go back, okay, Asian Americans, is because according to Stop Asian Hate report, 1 in 4 Asian American youth surveyed experienced discrimination, including verbal harassment, social shunning, cyberbullying, physical assault during the COVID-19 pandemics. And actually, the discrimination against Asians are not new. When you look at these pictures, you can see the interesting description on Asian Americans, and it's actually painful description of Asian Americans. And as you might have heard about, many Chinese actually came to this country during the gold rush, and they built railroads. And at the time, Chinese became a threat of taking jobs from white Americans. In 1871, one of the largest mass lynching in American history took place in Los Angeles, when 19 Chinese residents were killed by a white mob. And subsequently, Congress enacted the Chinese Exclusion Act in 1882. As a result of that, Chinese became ineligible for naturalization. And you can see these Chinese or Japanese have been perceived as economic threats, untrustworthy, and immoral. And I want to talk a little bit about pervasive bias and prejudice against Asians that has been going on for a long time. So perpetual foreigners, what that means is that these are the stereotypes that members of the ethnic minorities will always be seen as others in the white Anglo-Saxon dominant society of the United States. So I'll give you an example. So actually about 2 weeks ago, I had to go to the emergency room. I had some strange pain and I went to the emergency room. I'm fine, totally fine. But when I saw a doctor in the emergency room, the doctor is a white male, very tall white male with glasses. Okay, so he saw me and I was wearing a mask. As soon as he saw me, without introducing himself or without asking me, how are you doing? He asked me the first question, English? So I said, yes, I do speak English. And we had a conversation about why I had to be at the hospital, right? Came to the emergency room. So I explained everything, and I had to do some kind of, like CT scan or something like that. So I did that. And while I was getting all these things, for the diagnosis, I was getting really upset because why? I kept asking to myself, why did he ask me English? So after everything is over, before I was discharged, I asked him, doctor, I'm sure you're a good doctor, but you asked me English? And then he became very defensive. He was telling me, oh, because this is the medical terms, I wanted to make sure that you understand English really well so that we don't have a miscommunication. So I said, well, that sounds pretty good. However, you could ask me, do you speak English? Or you could ask me what language is convenient for you to speak English before you say English. Or I also said to him, you know what, Asians are viewed as perpetual foreigners. No matter how long we have lived in America, we are perceived as somebody who is foreign. So I had to do some lecture on him, okay? And we moved on. But this is the thing. I have lived in America more than 20 years, and I have 2 Ivy League education. I'm a professor at Boston University, but it doesn't matter from the eyes of Americans, from the eyes of white people or Americans, or who lived in this country for a long time. After all, we look like we are foreigners. We look like we are others. That's what I felt. And second, modern minority stereotypes. As you know, Asians have been, biased or have been recognized as modern minority. Some people may say, oh, that sounds really great. What's wrong with that? Well, I'll tell you why. Because it is not true. Modern minority, it really is a myth. It is not the truth. I'll tell you, I provide you some stories on that with the evidences. So when you look at as an Asian American AAPI as a whole group, it looks like AAPI have a very high income, which is true. So AAPI have a higher income compared to white or two more races, Hispanic or American Indian or African Americans. However, Asian Americans AAPI group has more than 50 ethnic groups. So let's take a look at this. When you divide the AAPI group into all different ethnic groups, now we see a huge differences, huge diversities within the groups. So although Asian Indians and Filipinos tend to have a high income, when you look at the other countries, the ethnic groups, for instance, Hmong, Laotian, okay, or Burmese, they're actually in the poverty level of the group, okay. And another interesting aspect is that Asian Americans have the greatest income disparity among Asian Americans compared to all other racial groups, compared to Black or white or Hispanics. So specifically, Asians in the top 10% of the income distribution earned almost 11 times as much as Asians in the bottom 10%. And the disparity is so huge, and this disparity is bigger than any other groups. Now, as you can also see, Vietnamese, Laotian, Hmong, and Cambodian groups, about 25 to 30% of the students never graduate from the high school. And you can hear that, a lot of Asian students are in the top schools. Yes, it might be true. However, you can also see that when we break down this Asian American AAPI group into the ethnic origins, the differences are stark. When you see the Cambodians, Hmong, and the Laotians, actually less than 15% of the students have graduated from colleges, and only 3% of them actually got the postgraduate degrees, which is a huge comparison, comparatively different from the Asian Indian group, which 39% of Asian Indian ethnic groups have a postgraduate degree. All right, so some of you have watched this movie. This movie has recently received the Oscar Academy Award, and this Minari story talks about in 1980s Korean American family, one Korean American family with the two children and a husband and wife. And what's interesting is that this woman, you can see on the right hand side, and her role was Sunja, is a grandmother, so mother of the mother in the Minari. So she's a grandmother, and in fact, her real life, she had lived in America for about 10 years. In 1980s, she got married to a very famous singer in Korea, and they decided to live in America. So they both immigrate to America, and several years later, she got divorced from the singer. And at the time in 1980s, even now, divorcee in Korea as a female is very difficult lives, socially, as well as is a very big social taboo, and economically also they have a very hard time. Now, so because of that, she did not want to come back to Korea, and she had two little children, but her English was pretty poor. So only job she could get at the time was $2.50 cashier in the grocery store. And $2.50 is equivalent to about $9.60 in the currency right now. So she went back to Korea. She went back becoming an actress, and she got an Oscar award in year 2021. But you can see, the point is that you can see that not being able to speak English as a woman, as a person who is divorced, as a single mother, what kind of life that you can have in America. as a child, as an immigrant woman. Another one is invisible minority. This paragraph was actually written by one of my doctoral students at UPenn. She described her sense of invisible minority in the following way. We don't understand racialized trauma unique to Asian American communities, not because we don't feel it, but because we don't talk about it. We don't know how to. Our parents didn't bring it up. Our teachers didn't profess it. Our politicians never mentioned it. There's no discourse, no social movement, no textbooks, no hashtag to express the racialized psychic condition. So then what are the mental health effects? So when you are dealing with modern minority myth, okay, and when you are dealing with the prejudice, the perpetual fall in the prejudice, okay, which I describe my own experience, what are the effects or outcomes do you have among Asian Americans? And first thing that I'm going to talk about is some mental health effects, particularly among the young people. So these are Asian American young adolescents, okay, compared to other racial groups. Again and again, so many studies, okay, accumulating evidence shows that Asian American young adolescents tend to have a higher rates of depression compared to other racial groups. And Asian American college students who are young adults, they also have a high anxiety level. They worry more. They worry about their image. They worry about social interaction. They worry about their future. They also have anxiety, interaction anxiety, and their interaction anxiety level is higher in white and African Americans. Asian Americans consider the suicide more, and when you look at Asian American women, okay, actually Asian American women aged between 15 to 24 years old have a second highest rates of suicide, complete suicide rates. And that rate is actually a little bit lower than American Indian. And this is substantially higher than US female overall population. And then going back a little bit more about Asian American suicide is that they rarely talk about their suicide issues, their suicide plan or sense of mental health problems that they may have. And because of that, prior to the death, actually, a lot of studies shows that Asian American people didn't really talk about their mental health problems. And despite of all this, you can see that Asian group, this is also young adults, and the graph shows the yellow graph, Asian Americans are least likely diagnosed with mental health problems. And again, this yellow graph shows that Asian Americans are least likely to receive the psychotherapy, and they are also least likely to receive the medication treatment. Then what about the structural inequality? Okay, because the outcome of a legacy of bias and prejudice has actually driven the mental health problems as well as structural inequalities. Okay, let's talk about the federal level. And really, I was really struck by this fact, and actually it was published in JAMA Network. For the last 26 years, NIH spent 0.17% of the total budget for clinical research on Asian Americans, plus Native Hawaiians, as well as Pacific Islanders. Can you believe this? This is 0.17% is closer to zero than closer to 1%. And ironically, NIH recently announced a very important initiative. It's called the NIH Unite, because NIH really recognizes the importance of addressing or reducing the structural racism, okay? But then, when they announced this, they neglected to include Asian American communities as a people of color. Let's talk about state level. In 2017, despite the Asian population comprising about 14% of the population in the New York City, Asian American organizations were only granted 1.4% of the total spending for social service contracts. It could be several reasons, okay? It could be because of the minority issues that people who makes a decision, politicians, or who makes a decision for the budget, they don't think the Asian Americans have problems. Therefore, they don't really allocate the money. Another important aspect is that Asian Americans as a group have the group which has the most difficult time in speaking English, in communicating English fluently. That's part of the reason why this group have difficulties with navigating, accessing to the health information or information related to grants. Okay? That's another reason. Now, you're looking at Asian American women, but I am, okay? Asian American women are least likely among all women to be promoted to the leadership position. I mean, this one fact after the other fact really shows the perpetual or chronic problems that we have in America. So let's talk a little bit about the fundamental issues and the issues that I've been just talking about. So I created a model called the trap model. What it is that this explains the psychological or more like structural issues that Asian American women are dealing with. This model was created based on my survey as well as a treating Asian American women and adolescents. And we actually have researched more than 2,000 women for the last 10 years. And I created a model because these people have been trapped, okay? But trapped in multiple levels. First is a psychological trap, and second is an interpersonal level trap. Third one is race trap, and the last one is in the healthcare setting, okay? So let me talk about the inner voice trap. Actually, I redo this one. I cleaned up, but I don't know why it was not saved. I'm sorry about this kind of errors that you see, okay? So the inner voice trap is the pressure, okay? Pressure to perform, pressure to achieve. So even though they might be so-called very successful Asian American women, they feel like they're not good enough. I see that and I hear that over and over again. They have the sense of perfectionism. The next one is interpersonal trap. Interpersonal trap has two different kind of traps. One is they're being trapped within the family system, and they're also being trapped in the romantic partner, with the romantic partners, okay? So I can talk more about that a little bit later. So what we see is that they have a lot of conflicts within the family members, particularly dealing with the parents. They have all different kind of cultural issues or priority issues that they are dealing with. They have a lot of conflicts. And then the next one is the racial trap, which I just talked about. Microaggression, racial slur, and sense of invisibility that they experience. However, they suffer alone. I showed the graph, right? Just a figure of these Asian American young people. They are least likely to get diagnosed. They're least likely to receive the psychotherapy, talk therapy, they are least likely to receive the medication treatment. So particularly Asian American women, we have noticed that these women have experienced high rates of trauma. And high rates of trauma, but they are also trapped by intersection of the family, gender, culture, and sexuality. So I'm going to go into that. What do you mean by the trauma? They experience trauma at home first. In 2012, we actually found that 70%, 7 out of 10 Asian American women that we have surveyed, that is based on 701 Chinese, Korean, Vietnamese women that we targeted, okay? So they have reported that they experienced either physical abuse, sexual abuse, or neglect, or combination of all. And we also published the study that those who experienced a history of sexual abuse, in addition to physical abuse and neglect, they are the highest risk group of the person who actually show that 12 times more likely to attempt suicide. So you can see that abuse is all bad, but sexual abuse is the most risky in terms of in connection with the suicide attempt and complete suicide possibly too. And this is a trauma outside of the home, is intimate partner problem, partner violence problem. So it's an IPV. So we found that the women, Asian American women who reported a history of forced sex were significantly more likely to engage in HIV risk behaviors. And they drink alcohol to cope with the problems. And they also attempt suicide compared to those people without this reported history of forced sex. We also, this is actually not from our study, but we have cited this study by Ku et al. Shows that compared to their white counterparts, Asian American female college students who were victims of the sexual assaults reported higher level of maladaptive belief about their assault. Okay, so they have a self-blame, shame, myth about rape, and consequently, they have a higher PTSD symptoms and severity. Okay, so this study was also done by our study. My doctoral student was the first author to publish this study. What we found was that out of 173 women who wanted to participate in AWARE intervention, it's a behavior group psychotherapy intervention. So they have reported that 63.8% of Asian American women who wanted to participate in our study reported psychological aggression, okay, with their partner. And 40% reported that they have experienced sexual coercion, and 4% reported that they had experienced severe. This is not just little injuries, it's severe injury and physical pain. All right, so trapped by intersection of family and gender and culture. Now, we published a study called Fractured Identity. So I wanted to study, all right, let me take a look at more on those women, Asian American women, who have experienced or who have done self-harm and who have had suicide ideation or who have attempted suicide behaviors. What are the common themes that can we discover? So we did the qualitative study. What we have found was that, you know, when I talked about the inner voice trap and there was an interpersonal trap, I talked about the families, right? They had a common theme of this disempowering, I call it a disempowering family dynamics. Okay, what do you mean by the disempowering family dynamics? So this disempowering family dynamic is that those women who were particularly trapped by these multiple things, they had a common parents who tend to have this type of parenting styles. A is abusive. B is burdening parenting, burdening these women or daughters financially, and burdening the daughters to pressure to succeed. And they also burden them, asking them to take care of themselves, take care of them when they get older. They also have a culturally disjointed, this is a C, and they have a culturally disjointed syndrome with their parents. So they have a conflicting cultural values and different languages they are using compared to their parents. And D is disengaged. There was a distance, okay, emotional distance, particularly with their fathers. And they feel dismissed, and they are feeling ignored, and they feel invalidated, okay, particularly with their fathers. Gender prescriptive parenting, which is ABCDG, is that parents tend to emphasize about their gender, stereotypical things. For instance, girls should wear this certain way, or girls should speak in a certain way, girls should pose in a certain way, okay? And a lot of women we interviewed said they never really were able to do the sleepover because the parents were very strict about them sleeping over in the other household. H, this H is not actually, was not included in the publication, but we also have noticed that we didn't have enough themes, so sometimes we don't really talk about it, but there's some heterosexualism that, these parents were emphasizing the importance of being heterosexual. All right. So I talked about this ABCDG parenting, right? And I have given a lot of talks about ABCDG parenting. But then I got the pushback. The pushback was that, when you talk about ABCDG parenting, it sounds as if you're blaming on these parents. So I took that comment very seriously because I really don't want to blame on the parents. And maybe, perhaps, there's a deeper story behind ABCDG parenting. So we decided to dig down the data that we have. So we analyzed the qualitative data. That these are all coming from the women's perspective. Okay, we actually are now collecting the parents, immigrant parents. Okay, but then we are in the process of collecting the immigrant parents data. But then based on this young women's data, they describe their parents. So we analyzed, we spent lots of time to understand what kind of background or what kind of issues these parents have. And we found that these parents, these immigrant parents, okay, have lots of social determinants of health problems. For instance, they had mental or physical health problems, or both mental and physical health problems. They were not divorced. Okay, some of them were divorced, but some of them were living together, parents, but they had huge marital discord problems. And they experienced the chronic social, cultural, linguistic barriers. I say this is social cultural because it's not only about the linguistic, it's also about not being familiar with American cultural stuff, the mannerism, okay? And, women that we interviewed, studied, these women have a very wide social economic spectrum. Some parents were making more than $200,000. Some parents were making less than $30,000. But then, regardless of the income that they have, all parents have a very strong job-related stresses. And as a family, they had a fragile social network. And some of the parents were dealing with trauma from their own country. And another aspect that we found was that these women, okay, the immigrant, child of immigrants, they had a very vague history to recall about their parents' immigration-related stories. They didn't really know about their grandparents. They didn't really know about their great-grandparents. They really didn't have a history related to Asian American families. Okay, so these women, they had little evidence of sense of positive self-worth. They constantly struggle with unresolved issues regarding the feelings of the never good enough and worrying about which culture they belong to, wondering about why they cannot have a normal relationship with their parents, and they describe their pain as an emotional numbness. And they also struggle with how to fit constantly or simultaneously into both US and Asian peer groups. So in sum, my understanding of Asian American families, they have high ambition. Immigrants have high ambition. Otherwise, why would you come to another country? Why would you leave your family members behind unless you have a dream to be better, to do better, to have a better lives, better quality of lives in America? So these people have high ambition, but they have a very high stress. Now, after the COVID-19, Asian Americans are dealing with unprecedented fear. And as I have described, they have low resources, low support, and constantly dealing with pervasive structural inequalities. So one of the women that we have treated, actually, after she completed our psychotherapy, which I'm going to talk about, it's called aware intervention, is that after she finished that intervention, which is 8 weeks, she said, it was a collective struggle that we have in America. It was not my parents' fault that I am depressed. It's not my fault that I am struggling. It's our own collective struggle as immigrants or children of immigrants that we have in America. So one of the studies that I wanted to talk about is the healthcare utilization patterns. Okay, so these women, so what we have found is that these women, they suffer from mental health issues, okay? And we compared the woman based on their risk factors. So there's a low risk, medium risk, and high risk women. High risk women is defined as women with current depression and those people who have had lifetime suicide ideation or attempt, okay? Then what we found was that, these people, even though they were very high risk people, only 37.5% of the women ever used any mental health care in their lifetime. Okay? And less than 20% have used intensive mental health care. And only 15% have used 8 times of mental health care. I mean, why is that? I was really curious. Why is that? So we looked at the qualitative study and to just try to find out, to make sense of this phenomena. Okay. So what we found was that obviously there's a stigma. We talk about mental health stigma, but mental health stigma, utilization of stigma exists in every single races, among white people, black people, Latinx, Asian, we all have stigma. You don't want to talk about the fact that you have mental illness or mental health problems. However, Asian Americans have more problems besides that. So specifically, parents tend to dismiss mental health concerns, and parents emphasize the saving face. Saving face culturally is very, very important thing. You don't want to talk about your problems. You're hiding the problems because, your face, your pride is more important than anything else. Sometimes your pride is more important than your life. And Asian American community also tend to have the issue that community disapproves burdening others with problems. Okay, so even young people have a big sense that I don't want to burden people with my problems. So they had this sense. But what I consider which is more problematic is that really there is a lack of culturally appropriate intervention models. Asian American women, they talked about the fact that, even if I try psychotherapy, I find that the psychotherapy is not for me because my therapists don't seem to understand what is really important for me. And I have to explain the certain things about why I'm so, I have such a love and hate relationship with my family, and I resent my family so much, but I just cannot just leave them behind. Why I feel so responsible. Okay, those kind of cultural stuff that women felt that they were not being understood by the therapist in the US. So we realized that our group, our team, research team realized that it is so important to study or create an intervention, behavior intervention, that mental health intervention that really incorporates the cultural understanding, cultural nuances, the values, and the trap models that I talked about, incorporating those issues in psychotherapy package. So we created an intervention. We were funded by National Institute of Mental Health to do so. So it is called Asian Women's Action for Resilience and Empowerment. So Asian American, so it's aware intervention. We have two different kind of intervention. We have a weekly group psychotherapy, and we also have a text message therapy. And the way that it works is that we are targeting each trap that I talked about. Individual, the inner voice trap, we're targeting inner voice trap. How do we target? We are actually trying to cognitive, use the CBT, cognitive behavior therapy, so that we are targeting to do the restructuring cognitively, okay, by providing alternative coping strategies. And family and peer, which was the interpersonal trap. How do we do that? We do the psychoeducation, okay, dealing with the disempowering parenting, and the race trap. We talk about bicultural minority stress so that we can develop the strong sense of self. We also directly provide socially and culturally specific mental health, which is aware, and we provide, text messages. So that's what we are doing. That's for the active ingredients. So we have a hypothesis, the mediators, and then outcome that we are projecting is that therefore Asian American women who experience aware or things like this is going to have a better health outcomes, lower rates of the suicide ideation, attempt, and PTSD, and eventually this is going to reduce the mental health treatment. So, according to NIH stage model, in order for you to develop an intervention, you have to go through these models. stage 0, stage 1, stage 2, and stage 3. We have gone through stage 0, which is a basic research. Stage 1 is you do the preliminary study. Stage 2, you have to test the efficacy study. We are actually trying to do the stage 3 study. So we have submitted a proposal, R01 proposal to NIH several times actually, but it has been rejected. We got funded to do the stage 0, 1, and 2, but it is really difficult to get the R01 to be successful. I mean, I've been thinking a lot about this. It's partly because, again, modern minority myth. And I am dealing with this issue, you know, in the context of the writing on grant proposal, in the context of pushing NIH to provide more funding for our, you know, our population so that we can change this mental health outcomes. So I'm working really hard to really to address this issue. Okay, so far, based on stage 2, we have an efficacy study. We have been successfully showing that aware intervention has reduced depression, particularly people who are struggling with or have a high risk of PTSD. We also tried out aware intervention in 3 different healthcare settings. It was a small samples. Wellesley College, Harvard University, and Boston University. And we also have a publication which shows the efficacy study. So what's the action plan? I understand that we have a very limited time now here. So action plan is the number 1 is federal investment to AAPI health. We need more funding to really study Asian American women, because at the end of the day, we cannot fix what we cannot see. You know, Senator Elizabeth Warren talks about this. We cannot fix what we cannot see. We need to collect the data so that we can develop the responsive policy so that we will change the status quo. And number 2 is utilization and developing the evidence-based treatment is going to be really critical. The example is aware intervention. And I really advocate that we should develop the intervention for the women and the men, the older people, with the LGBTQ Asian American population is going to be critical. And having ongoing conversation or talk on race is going to be also critical. And finally, importantly, we really need to take actions, individual action and group action. We need to work toward the activism, and we need everyone's help, not just the Asian Americans, but we need to work with white, we need to work with the Black community, we need to work with Latinx community, we need to work with American Indian community. We all have to work together and work in solidarity. Okay, so thank you so much. And if you have any question, I would like to address some questions.
Thank you so much, Dr. Hamm, for such an insightful presentation. I learned so much, and you did such a beautiful job of sharing so much information in such a practical way. So thank you. Thank you once again. So yeah, we have a few minutes to take some questions. I'm getting some comments in the chat box. Someone just said, excellent, thank you. We know that. And let's see right here. So the first question I have is, and I think you touched on this during your presentation, but maybe the person asking may want a little bit more information. What are some cultural barriers that may prevent Asian American women from pursuing therapy?
Yes, so I talked about it, and what it is that we have a stigma that we are dealing with. But really, what's difficult thing is that not only the stigma, we don't have a psychotherapy which has been incorporated our cultural issues, the family issues, the immigrant histories, the history that our parents are dealing with, and this discrimination, this COVID-19 discrimination, the fear, the PTSD, the racial trauma that we are experiencing. We need to create an intervention. And people have to know about this intervention, that this is available to deal with our mental health issues. Because you know what? If we don't have a good mental health, how can we work? How can we raise our children right way? How can you become a good member of the society when we are suffering alone.
Absolutely. Thank you. Thank you. And speaking about intervention, someone asked, is your AWARE model available nationwide, specifically in New Jersey? How can we have access to that?
Okay, that's a very good question. So I was actually teaching AWARE model school by school, and I couldn't do it anymore because you know what? I'm a researcher, I'm a teacher, I'm doing a lot of things, right? But I did try. But then so what we do now, Boston University has invested in my group. So now what we are doing is that we are actually developing a video, which is online AWARE training program. So it's a trainer for the trainers. So actually, I'm going to have a first shooting at the end of May. So just wait, and I given information to Irina so that she will be sharing with you. So I think that it may take about 6 to 8 months or so from now on to be available on online course.
Wonderful. Yes, and I'd be if you send that to me, I'd be happy to share that with the participants on this webinar today. Absolutely. Yeah, thank you. Let's see another question. Do perinatal mood and anxiety disorders show up differently in Asian American women? Do they present or complain of somatic symptoms as opposed to admitting that they have anxiety?
I think that's a very good question. So for Asian Americans, yes, somatic symptoms like stomach ache or headache and back pain, those are very common themes, yes. Because some women, they don't have words to describe and they feel very embarrassed to talk about, but they feel really good. They don't have any problem talking about the somatic symptoms. So culturally, yes, it has been. And what about, perinatal specific women? I don't know about that. Maybe there are some new studies on that. I would like to know more about it. But in general, Asian Americans have a greater rates of somatic symptoms. So it's important to go deeper, So as a nurse practitioners, we need to ask those questions like, okay, so do you have anxiety? Do you feel like, so anxiety symptoms? Just lay out all the symptoms of anxiety to assess that. Somatic symptom might be one of them, but they might be really struggling with the PTSD or generalized anxiety.
Thank you. Thank you, Dr. Hamm. And I have one last question here. Are there any relationship dynamics between couples that we should be aware of and that we should keep in mind?
I think, yes, couple, what I'm thinking is that because right now, Asian American people are suffering so much and they are, particularly women, have been the target, right? I think 70% of the victim have been women. So a lot of women might be in a lot of stress and fear, and they're avoiding to go outside, avoiding to walk, avoiding to have a social life. Rightfully so, right? Because they're being targeted. I mean, we are being targeted. So I think what we should be mindful is that these women are particularly having this racialized trauma. So they may are showing more stress at home, or crying episode or depressive symptoms at work. So I think those are the things that we should be more mindful about. And they could be having more domestic problems, domestic violence or domestic problems, because the children are also having a huge anxiety problems. Asian American children are having huge anxiety problems. But then again, we can't really find the therapist to treat them. So this is a tough time. I think this is a wonderful program that you're providing, and it's great that you're learning about Asian Americans issues. And it's important to spread the words and spread this education so that we will be standing by Asian Americans and to deal with this terrible, terrible problem, which is racism.
Thank you for your response. And I do see a few other questions popping up, but what I can do is, since we are very limited on time and have to finish now, I can send them to you, Dr. Han, so you can maybe answer them privately to the sender. So again, I just want to thank you to you and to our audience for submitting such great comments and questions. Many thanks to our Director of Education, Sarah Mueller-Robbins, who helps us make these programs possible, Karen Amadeo, who is handling the technical backend of the program, and of course, the New Jersey Department of Health for their support, and all of you who have joined us today. A reminder that in about an hour, you will receive an email with a link to a post-program evaluation, and your feedback is important, so please take time to complete this. And certificates of completion will be sent via the mail you provided on the evaluation. So please make sure that that is correct. And you should receive that within a week or so. Lastly, our calendar of the partnership's upcoming virtual programs, including next Wednesday's talk, which will be on perinatal mental health in the Latinx community, can be found at pmch.org under the Professional Education tab. We also offer on-demand recordings of many of our past programs, which are listed there as well. So thank you again, and we hope that you can join us next week. Have a wonderful rest of